Hi, welcome back. Today I'm going to demonstrate Ortho Expert. Before I get started, Ortho Expert minimum requirements are iPad 2, iPad Next Generation, or iPad Mini. It is highly recommended that you enable cloud backup to your device to avoid accidental loss of patient data. A little background. This app was developed to assist the orthotist, certified orthotic fitter, and podorthist with the proper documentation and assessment. The app is ideal for compliance, audits, accreditation, risk management, quality assurance, and professional documentation. This is the home screen. We'll log in. The administrative function, basically, if you forget your password or username, the program will send that answer to your registered email address. Any field marked with an asterisk throughout the application requires data. Patient. This is your general patient information screen. Not every field is required. Those fields marked with an asterisk are required. Medical history. In this case, there's a great feature where there is a text option throughout the app. You can use the iPad's dictation feature. I'll demonstrate. The patient has a history of a diabetic foot ulcer, period. There are 20 evaluation screens, comprehensive in nature. You'll notice that arrows pointing to the right indicate that the assessment has not been done. Arrows with a check indicate that the assessment has been done. I'll demonstrate a few of the really cool features of Ortho Expert. The assessments marked in color are comprehensive to the region of the body affected, in this case the ankle. You'll see the simple yes and no questions, anthropometry, and visual assessment. Each evaluation is unique to that region. Breast evaluation has a comprehensive approach to a patient undergoing or planning to undergo a mastectomy. We added a bra cup size calculator. You'll see the value is 2. You'll notice to the legend on the left, 2 inches is a B cup. This demonstrates that you've taken the time to actually measure the patient, and the program acts as a quality assurance to ensure the proper fitting. Lower extremity assessment is a comprehensive approach to the foot and lower extremity. There is a shoe wizard. There are picture options. In this case, I'll choose from an album. To review the image, you can simply just click on it. You can mark the foot sections or foot areas, the anatomical feet, if there's not an option to take a picture, or if you want to just make notation of areas of concern. So simply click anywhere and a mark is made. There is a conversion tool for inches to centimeters. This is useful. Some manufacturers for certain devices require inches, some for centimeters, and you have that option without having to worry about conversions. In some areas, we have auto calculators, such as the ankle brachial index. In this case, I'll type in 120 for the brachial pressure and 100 for the ankle pressure. you'll see that the ankle brachial index is 0.83. And below you'll see some additional documentation you can make with regards to the lower extremity assessment. There is a balance score. The balance score, the Chinetti balance score, basically a score of 16 is a perfect balance, but if you actually have the patient perform these tasks, and I'm just randomly selecting, 13 over 16 is perhaps not too bad, but a 6 over 16 would indicate a more severe balance issue. Perhaps an orthosis or a shoe or a brace could be used to modify the patient's gait to improve balance. We also have the ability to measure the patient's risk factors for developing sores and wounds. So we will go to the integumentary system, and you'll see we have the Braden score here. Again, it auto-calculates. So the patient's approaching high risk, and you'll see there are modified risk factors that can be considered in addition to the risks from the Braden score by itself. Patient goals is a wonderful tool. With every device, you can establish with the patient expected outcomes. And you'll see below here that there are many to choose from, and you can add new ones. The more you use the program, the more it remembers what you do, and the easier it gets. You'll notice that patient goals are in a SOAP note format: subjective, objective, assessment, and plan. You'll also see at the top patient perception, which is very important in terms of for the patient's motivation in terms of getting a new device, orthosis, or shoe. There is a really cool feature called gait analysis. And the user simply selects the areas of concern, beginning to describe the primary limb or condition that has a direct or indirect effect on the patient's gait. That's easy enough. Then you can ask about the history. Is there a history of falls, fear of falls? Is there some neuromuscular condition that contributes to this problem? You can then list all the various devices that the patient has had, or currently uses. And then you can do a video, anterior, posterior, and lateral. In this case, I've already captured a video, so I'm going to play it. So I can go back and I can review a patient's gait and make notations to better assess their condition. You'll see the observational gait analysis, weight acceptance. You can select all that are true. The digital goniometry is great for establishing range of motion, particularly in situations when there is some loss of range of motion or contraction. So we will choose, in this case, at rest. The affected body member I'm going to do is the knee. The side affected is the right. And now we will add a picture. You can take a picture with the patient, or you can take the picture and go back and do this. In this case, I'm going to choose it from my albums. Now I will select or just press on certain anatomical locations. And the program calculates the biomechanical angle. That's at rest. You can do comparison analysis where a device has been provided so you can demonstrate increased range of motion. It's a very effective tool. Orthometry charts are listed here, and I'll just choose the CAFO. The user just enters the values, chooses left, chooses right, and it is saved. We can add progress notes. Progress notes are date stamped and time stamped. And again, you can use the dictation feature, and it's a wonderful, wonderful feature. Now we will go to the brace prosthesis editor. Here we can add service. And really, service is encounter. What's the reason to be with this patient? What is the reason why service is being rendered? And you can see there are multiple reasons. This is an outcomes measure that you can use later to report your quality care. We can describe the services, we can list parts, we can take pictures, we can add videos, and then we can schedule our next visit. It's a great, great tool. The orthosis prosthesis editor allows the user to enter various orthotics and prosthetics. The user then can assign those devices to their patient, and you can even take a picture with the device on. This shows that the device fit properly and is functional to the patient. There's an education sheet. Essentially, we can provide education at the bedside, essentially right with the patient in real time. So you can review like the goals, you can select the item, purpose, expected outcome, wear schedule, precaution, care and maintenance, and any additional comments you might have. I have to enter a patient. Then you can even have patient sign. Pretty cool feature. Customer satisfaction. After a set period, you can even use the service editor as a follow-up to your next encounter with the patient, and then this purpose would be for satisfaction survey. Then we have reports. Essentially, everything that's in the program you'll be able to pull out. There are 17 standardized reports, and you can modify some of them with time, date, and other specific data that you choose. About us.